Students, welcome to lecture 26 in biopharmaceutics and pharmacokinetics. And as you know that we are discussing pharmacokinetics of intravenous infusions chapter. And in that series, this is the third lecture in that series of lectures. And in this, we are going to focus upon steady state level, a time to achieve steady state level, and the impact of the rate of infusion on steady state levels. So in today's lecture, we will discuss about steady state of intravenous infusions and then the time which will be taken to achieve the steady state, how long it would take, how it could be calculated, impact of infusion rate on steady state, and factors affecting steady state level concentrations. So these are the main outline of today's lecture. So, steady state concentration in clinical practice. Students, as you know, that sometimes the things we read theoretically are not that much resemble to the clinical practice or the practical things. In clinical practice, what happens that the steady state concentration is exactly not that concentration which is supposed to be at steady state level. So, what is actually happening that in clinical practice, a plasma drug concentration prior to but asymptotically approaching the theoretical steady state is considered the steady state plasma drug concentration. It simply means that as we discussed in one of the graphs in previous lecture that this is a point soon after which the steady state level will be attained immediately. So that point they are talking about that actually the clinicians are usually concerned about that point, that when that point would be reached, when we will be able to achieve that concentration. And so theoretically, that is a state when the steady state plasma concentration has been achieved, but asymptotically, that is approaching that state, that is approaching that steady state level, but it is immediately before that level. So students, up till now, I hope that you people are well aware about the concept of steady state level. What is steady state level? What are the steady state concentrations? And what is zero order infusion rate and first order elimination rate? But still, as today's lecture entails mostly about the steady state level, we will be discussing a different aspect about it. So again, a brief recall of steady state level. What is it? When a constant intravenous infusion drug solution is infused at a constant or zero order rate, which is denoted as R, during the intravenous infusion, the drug concentration increases in the plasma and the rate of drug elimination increases because rate of elimination is concentration dependent. That is, rate of drug elimination is this much, KCP, and K whenever gets involved, that is showing the first order rate constant. That is simply showing that rate of that process is proportional to its presence here in this equation shows that this rate of drug elimination is directly proportional to this, the concentration of the drug, which I mentioned times and again that basically first order means the rate of the process, whatever process is that, irrespective of the fact, the rate of the process is directly proportional to the concentration or amount of the drug. So the concentration keeps increasing until the steady state is reached, and steady state is somehow a stable state. At this state, there is no change in the concentration any further. That will maintain at that level. And if, for example, at that stage you stop intravenous infusion, the level will drop immediately, which is one of the benefits of using the intravenous infusions. So that we will be discussing in our next lecture, the various benefits and important considerations for using the intravenous infusions. So time to achieve steady state level. It is it is of much interest for the pharmacists, for physicians, because everybody in the healthcare team is usually interested that when that point or that level would be achieved, when which is called the desired or therapeutic drug concentration, which is providing the maximum therapeutic benefit with lesser minimal side effects. And in case the side effects are started to be experienced by the patient, in case of intravenous infusions, side effects are not an issue, because you know that anytime if immediately this intravenous infusion is stopped, the rate will you can say that the curve or the drug concentration will fall exponentially, and the patient will definitely be experiencing release of the side effects. So, in clinical practice, the activity of drug will be observed when the drug concentration is close to desired plasma drug concentration. Usually, before that, you can say that there is inner phase when the level is rising, and reaching to the level which is the desired one, and then where it needs to be monitored and maintained, and the patient would be at a constant therapy. So, this level is highly desirable, and this targeted or desired concentration is actually the steady state drug concentration. The pharmacist or the healthcare practitioners are actually interested in this. So whenever we are talking about the targeted or desired concentration, we are not interested only in the concentration, but its maintenance for a certain set period of time, which is the steady state drug concentration we are talking about. So the good news is that it can be assessed that how much time it would take, how long it would take to reach to a certain level of steady state, like time to reach the 90%, 95%, and 99% of the steady state drug concentration can be easily calculated. And when a pharmacist knows or a healthcare practitioner knows that 90% of the drug has the drug concentration, which is steady state concentration, has been achieved, they have this idea that they are close to that level, which is the desired one. 95% means they are very close, and 99% means that asymptotically they are at that level. Theoretically, they are close to the steady state level, but asymptotically 99% means that uh, that level has been achieved. So let's we talk about the concept that how supposedly that time which is required to reach a certain steady state percentage of a steady state is can be calculated. So you can see that we have percent of steady state attained, and then the number of half-lives. So each percentage of a steady state is associated with a certain number of half-lives. So for example, we take the first example of 90%. So 90% steady state level of the steady state level would be attained, and this number is associated with 3.32. Now, what does it mean, half-lives? It just simply means that we take the example of a drug which has a elimination half-life of let's suppose it has an elimination half-life of 4 hours. So what this concept simply means is that if we multiply this number of half-lives, this many number of half-lives, if let's suppose we are interested that how long would it take to attain the 90% of the steady state level, then it simply means that we are supposed to multiply um, this number with the this elimination half-life, which is 4. So we are getting almost 13 13 hours. 13 hours will be taken in order to attain the 90% of the um, 90% of the steady state concentration. So the same concept is applicable here whenever we are interested that how long it would take to attain the 95% of the steady state level or the concentration. That simply means that multiply that elimination half-life with this one number, this 4.32, and 16 or 17 hours. Then the next possibility is 99%, and that is the level which I already told you people that is indicating that it is the point where 99% of the steady state level will be achieved theoretically, but theoretically it is just before the steady state level, but asymptotically or clinically speaking, it is just the steady state level. It is the point when you hit the steady state level. So multiply 4, if for example the drug in consideration or in question is having a half-life of 4, then multiply that with 6.65. Almost the value would be carrying would be 60, 25, 26 around hours. So this much time would be taken to achieve this level. It is a very and according to that the level or rate of infusion can be set, and then the required results can be obtained. But one thing is should be clear, and one thing must be kept in mind, that this thing has nothing to do with doubling the rate of infusion or tripling the rate of infusion. No matter how much you increase the rate of infusion, but the rate a certain at a certain rate, whatever the drug is and whatever its is a half life is, the time taken to achieve a certain steady state level would remain the same. And this concept we are going to discuss in the next slides, that would be the impact of the rate of infusion upon the steady state level. So after intravenous infusion of the drug for five half-lives, the plasma drug concentration will be between 95%, which simply means that 4.32, that is the same number which we have discussed in the previous slide, and number of half-life is being multiplied with the elimination half-life, the concept which I explained already, and 99% 6.65 would be multiplied with elimination half-life of the steady state concentration. So that is the same concept which I discussed in detail in the previous slide, and that is being elaborated further. So I hope this concept is now clear. So, for therapeutic purposes, the time for the plasma drug concentration to reach more than 95% of the steady state drug concentration in plasma is often estimated. So, when it comes to the clinical application of this concept, of course, it is these all measurements and calculations are applicable at the clinical level, and these are directly applied concepts. So when it comes to the clinical level, most of the time the physicians or the pharmacist are what interested in is that when they would be able to achieve 95%, 90%, or the 99% at the end of the day of the concentration of the steady state level, and the 99% of the concentration, steady state concentration, simply means that they have achieved the steady state level. Though this concept is a little confusing, I already discussed that though theoretically it means that this point is just immediately before the steady state level, but what practically it means is that the steady state level has been achieved. And the why the clinicians or the pharmacists are interested in this level, or this much percentage, and usually they are calculating it and they are trying to find it out that how long it would take to reach this level, is because this level helps them to maintain that concentration, which is the desired concentration, to maintain at that level, to maintain that desired concentration in a way that it is not changing. As we already discussed, that steady state level is the level that where the concentration is not changing. So that's why the clinicians and the pharmacists are interested in these values and in these measurements and calculations. So impact of rate of infusion on steady state. So here is the tricky part that most of the time students get confused and they think that let's suppose if increase the rate of infusion, so it means that it would take lesser time to reach the steady state level or the steady state desired steady state concentration. Your concentration, if anything would happen after that by after increasing this in rate of infusion, that would be raise or rise in the concentration and not um, decreasing the time which is required to achieve the steady state. So what it simply means that an increase in the infusion rate will not shorten the time to reach the steady state drug concentration. Not by any means. If you, for example, increase the rate of infusion, if, for example, you double it than the before, then it would be in your mind that we are increasing the rate of infusion. So it means that steady state level would be achieved earlier. So, but it won't affect that in that way. It would simply means that your steady state level would be still achieved at the old timings, but the concentration which you are trying to achieve is increased. That is increased now. So by increasing the rate of infusion, just the more drug is entering into the systemic circulation. Otherwise, the time which is required to achieve the steady state level, that would remain the same. And if the drug is given at a more rapid infusion rate, a higher steady state drug level will be obtained. But the time to reach steady state is the same. That is the same concept which I already explained. No matter you double it, no matter you make it triple or you increase it more, the only thing which would happen that would lead to a dangerous situation, that would lead to saturation kinetics, that might possibly lead to a situation where there is zero order kinetics even by elimination process as well, adopted by the elimination process. And so this is a dangerous situation. Both absorption and elimination are following zero order kinetics, and there are all the enzyme transporters which are saturated with, this is what you call saturation kinetics. So in that situation, the patient is in dangerous zone, because if the level has been increased to much, that is has entered into the toxic concentrations, then if you immediately stop the intravenous infusion even, then still the level won't drop because elimination rate is following zero order. So these are the main things which are supposed to be kept in mind whenever the intravenous infusions at their rates and their when the certain level would be achieved and their concentrations are being decided. These are important things which are need to be considered and to be understood completely. Here in this graph, you can see the same concept which we were discussing in the previous slide. Um, this curve is showing the rate of infusion, 1, you can see, and then this curve is showing rate of infusion when it is almost double than the before one, than the previous one. And you can see that the time or the position where the steady state level is being achieved in case of 2R and in case of R is the same. It is the same. Um, I explain it with the help of a pen. So this one is showing that rate R is at a certain level, but then it this one is almost the double of the previous one, and still you can see that this state and this state which is relevant to this time when you are going to achieve it, this is the time when you would be begin to achieve it, that remains the same in both cases. It is the same, and that simply shows that by increasing, which we were discussing, that by increase in the rate of infusion, no matter you double it, you triple it doesn't matter, but the time it would be achieved to attain the steady state will remain the same. It would simply increase the concentration, that like now you can see that this much difference in the concentration has come and the concentration has increased. So these are the things which I were explaining in the previous slide, and I hope now these are much more clear. And I repeat again that there is a raise in the concentration, and the concentration has increased, and which could lead to potentially dangerous situation if the rate of infusion is being increased in the hopes of getting the steady state level as earlier or as soon as possible. The only thing which you will get would be increased concentration. Steady state level would be achieved at the very same time. That won't be obtained sooner or later. So factors affecting steady state concentration. Steady state concentration, as mathematically we know, is equal to R divided by V dk. The steady state concentration is dependent on the volume of distribution. Mathematically, this equation what shows is that steady state concentration is dependent on the volume of distribution and the elimination rate constant and the infusion rate. So altering any one of these factors can affect steady state concentration. It's very simple to understand that as steady state concentration is dependent upon these factors, so steady state concentration will definitely be affected if any one of these is for example, if rate of infusion, as we were previously discussing, steady state concentration and rate of infusion has a direct relationship, and when rate of infusion will be doubled, the concentration which you might be achieving at steady state, though the time, remember the time which you would take to attain the steady state will remain the same, but the concentration which you would be you can achieve will be increased as well. And similarly, if certain factors are happening within the body which are causing some increase in the elimination rate, then in that situation, the concentration which could be achieved at steady state level that would be decreased. As you can see, there is an inverse relationship is being suggested by the mathematical equation.